Hey everyone, welcome to lecture 1.1 from module 2 in RAD104, and we are going to start discussing pharmacology. Alright, before I dive into the material, I want to let you know that all of the information that you're going to hear about pharmacology is coming from these books here. This is your Adler book, or your Introduction to Radiologic and Imaging Sciences and Patient Care. These are great books. If you haven't really looked at them, you should take a look, because we are going to use these books again this semester when we talk about medical ethics and medical law. So they have a lot of great information, and they are going to be very, very helpful for studying for the registry exam. A lot of the questions that you'll see in Board Vitals that are relevant to the registry come from the Adler book. So these are some books you should really pay attention to and take some time to look at. So what is pharmacology? And before we do that, I'm actually going to ask, why are we even bothering talking about pharmacology, especially in this class? And the whole reason for it is because we just talked about fluoroscopy and we just talked about CT. Those two imaging modalities frequently use, if not always use, some form of contrast. So we have trouble seeing soft tissue anatomy, especially when we're doing regular diagnostic fluoroscopy. CT is a little bit different, but CT uses contrast a lot in order to highlight or to bring out or give us better contrast of certain anatomy that we might have difficulty seeing. So we use contrast with those two modalities, and that's why we're jumping into pharmacology now. Now, pharmacology will be on your registry. We need to be aware of what could potentially happen to a person who is going through an adverse reaction, and how do we handle such an emergency situation. So that's why we're discussing pharmacology. So let's start off. What is pharmacology? Pharmacology is the study of drugs in living systems. Okay, that's going to be your basic run-of-the-mill definition. There could be variations of that, but pretty much if you've got a registry question on what is pharmacology, it's just looking at drugs and its interactions with any type of living system. So that's kind of your overall encompassing definition. I've seen different definitions used in Board Vitals and with other registry questions, but as long as you have an idea of that's what pharmacology is, you should be good to go. So if pharmacology is the study of drugs in a living system, the question then becomes, what is a drug? And a drug is any type of chemical substance that produces a biological response in a living system. Now in medicine, we use drugs to aid with diagnosis. We use them to treat disease, and we also use them to prevent disease. Now, you're probably familiar with the fact that we use drugs to treat and prevent disease. It probably makes sense. That's what we always think of when we think of medicine. But we usually don't think about it as far as diagnosing, using a drug to diagnose something. And that's where it comes in with regards to diagnostic radiography, or CT. We're going to use these drugs in order to help diagnose somebody's problems. The reason why people study pharmacology is because, yes, drugs are great because we are going to elicit a response, but unfortunately, a lot of drugs also have side effects or unintended consequences. And so that's where the study of drugs or pharmacology is important, so that we are responsible and we know what to look for and we know how to manage the use of these drugs in order to use them safely. Now, there are a lot of drugs out there. There are a lot of substances that we know that will elicit a response within a living system. So there are different ways to classify these drugs. We can classify these drugs by their name, and there are different kinds of names that you need to be aware of. We can classify a drug based on its action. What does it elicit? What does it do to the person's body? And then we can also classify drugs based on their legal classification. And we'll talk more about that as we get further down the road. All right, let's start off by talking about drug classifications by name. Now, there are three kinds of names you need to be aware of. There is the chemical name of a drug, the generic name, or sometimes called non-proprietary name, and then there's the brand name or the trade name of a drug. So let's talk about these three names. Now, to help understand the names a little bit better, I'm going to be using just your over-the-counter Tylenol to discuss all three of these names. All right, Tylenol, just to jump the gun, is your brand or your trade name. So we all know the word Tylenol, but Tylenol comes with different names. So there's the chemical name. The chemical name is usually a very long, complex name, and that kind of helps chemists or scientists figure out what the molecular structure is of that chemical. So the chemical name for Tylenol is actually this right here, N-acetyl P-aminophenol. All right, that is a beautiful name for a chemist or someone who's going to be putting together Tylenol, using the chemistry, using a laboratory to create Tylenol. And this helps them understand the molecular structure of it. That's not going to stick in my head, though, when I want to go buy something. So I'm not going to use that name. But the chemical name will help chemists, will help the scientists know who are putting it together that this is their molecular structure. So to make it a little bit easier, we have something called a generic name or a non-proprietary name. These are a little bit less complicated than spelling out N-acetyl-P-aminophenol, okay? And they're kind of like a shorthand version of that name. And so the generic name for this is acetaminophen. Now, I'm sure you've seen acetaminophen all over the drugstore because now more than one person can make acetaminophen. You can get CVS acetaminophen. You can get Walgreens acetaminophen. You can get Market Basket. You can get all these other brands or companies to say that they sell acetaminophen. Okay, but they cannot use the word Tylenol. This is owned by Johnson & Johnson. They are the makers of Tylenol. So, I mean, we all know the word Tylenol because Johnson & Johnson is what, created the molecule and acetyl-P-aminophenol. And so they get to use this brand name or this trade name Tylenol. But if you're going to buy it from CVS or Walgreens, they cannot use the word Tylenol. They have to use acetaminophen. So this name is specific to an assigned name by the United States Adopted Names Council. And so we are able to use this name with other brands or other companies making it. So more than one company can now use acetaminophen. They can sell acetaminophen. They just can't use that brand name that we all know of Tylenol. And so finally, we're here to brand names or trade names. It's the name that is developed by the company that requests approval for the drug by the FDA. And so since they are the makers of the drug, they are the original owners of the drug, they get to make their brand or trade name. And so Johnson & Johnson decided to call acetaminophen Tylenol. And we all know that name now. And so I'm sure you could think of other examples besides Tylenol. We all know Advil. Advil is a term. Motrin is a brand name or a trade name. So just some other examples of pain relievers that we have out there and the trade names associated with it. So sometimes these are also called proprietary names. And again, those are the names that are owned by specific companies making that specific drug. So you've got all of these names, all of these chemicals, and all of these drugs, and they can all do different things. So it'd be nice if we had a place where we could look up different names of different drugs, the side effects, the intended effects, contraindications, anything. And we have that, and it's called the PDR, or the Physician's Desk Reference. This is a registry question. There's no doubt in my mind that this will be on your registry. So make sure you know what the Physician's Desk Reference is. It's just a book listing all of the drugs that could be used in a medical situation. It gives you the accepted uses, side effects, contraindications, and normal doses of the drug. So every department should have it, whether or not they actually do. At least they can get reference to it, or find a department that will have it. But every hospital is going to have a physician's desk reference that helps them with any type of issues with regards to drug usage or drug administration. And with that, I'm going to stop here because we're going to jump into something new. We're going to talk about the classifications of drugs by their actions. And so that's going to be a long segment. So I want to stop this here. If you have any questions about the different names associated with drugs, if you have any questions about the definition of pharmacology, let me know. Otherwise, I'll see you all at the next video.